Well, good morning. We're speaking today from the territory of the signatories of Treaty 7, and I acknowledge the Métis people who share a deep connection to this land. I'm joined here today by Dr. Tommy Mitchell and Dr. Alana Luft, and by our Alberta NDP leader, Rachel Notley. Now, for many of us, our first experiences of healthcare were at our family doctor's office. We went in for a routine checkup or to ask questions about our health or to get help with monitoring chronic conditions. Often, we would build a trusting, valuable relationship with our family doctor over many years. But today, access to family medicine is sadly out of reach for hundreds of thousands of Alberta families. This loss of access to primary care is driven by two things. First, the impacts of the COVID-19 pandemic, but second, the open hostility of Danielle Smith and the UCP to family doctors and other healthcare workers. In fact, it's almost exactly 3 years since the UCP launched their war on family doctors here in the province of Alberta. They tore up their contract. They cut their pay. They bullied them online and in person, forced them to take on mountains of new paperwork just as the pandemic was slamming into Alberta. Well, as a result, over the last 3 years, many have chosen to leave our province, retire early, or have left the profession altogether. And without access to primary care, many Albertans are left in a position where their medical conditions have gone untreated until they've reached a crisis point. That means that they now need a ride in an ambulance to go to the emergency room, the single most expensive and overstretched way to deliver health care. And just ask those who work in an Alberta hospital these days, they'll tell you that people are arriving there sicker than ever before. Those emergency room doctors and nurses will tell you that so much of the chaos they are experiencing is driven by the collapse of primary care in Alberta. Now, we're committed to ending the UCP's chaos in healthcare, and that means rebuilding the foundations. So to tell us a bit more about the importance of primary care, I'd like to introduce Dr. Alana Luft.
Thank you, David. I've been a family doctor in Calgary for 14 years. I was born, raised, and educated here. I was just starting my practice as a locum physician when primary care networks were being developed, and it was exciting to see the introduction of elements of team-based healthcare. I've had my own practice for the last 8 years within a primary care network, which includes access to multidisciplinary team. I'm grateful and proud to work in a setting where we have mental health supports, pharmacists, health management nurses, and others available to support our patients. There's much more to be done to make primary care and team-based care more effective and to improve health equity between different communities across the province. I'm glad that Rachel Notley and the Alberta NDP have set out a vision to transform primary care where the family doctors and other team members can provide better support to patients for early treatment and preventative care. If patients have access to accurate information, timely screening, regular check-ins with a provider who knows them, then we have a better chance of keeping people healthy and addressing issues early. If we're able to optimize wellness and reduce incidence of severe disease in the primary care setting, there will be far less stress on hospitals and emergency rooms, where the costs to the individuals and the system are much higher. It seems like an easy call to make. Investing in and supporting primary care is essential to addressing the healthcare crisis in our province. I'm confident that more team-based care will lead to better patient outcomes, give Albertans better access, and reduce the pressure on other areas of our healthcare system. I'm glad the plan presented today includes commitments to work with family doctors, nurses, and allied health professionals to make changes to primary care. The UCP's approach with physicians has been the complete opposite. Since 2019, their treatment of the medical community, and especially primary care, has felt like a gut punch. The lack of respect from and loss of trust in this government have only added to the extra challenges that came with the pandemic. It is thanks only to the strong collegial and caring relationships in the workplace that has gotten our healthcare system through the last few years, and not without damage. I've never seen a crisis like the one we've all been living through for the past 3.5 years. We need a vision from government that works with doctors and healthcare workers, not against them, to solve this crisis. Thank you.
Thank you.
Well, thank you, Dr. Luft. Now I'm happy to invite up Dr. Tommy Mitchell to speak about the importance of mental health support in primary care.
Thank you, David. Mental health is a foundation for societal health, but as a society, we're not investing enough or effectively in mental health. In terms of economics, the annual cost of mental health in Canada is estimated at over $50 billion per year. Instead of working on the root causes of mental health challenges, we sometimes focus on just the symptoms. Essentially, we are putting Band-Aids on problems that need a surgical intervention. There needs to be a dramatic increase in the investment in mental health. By the time Canadians reach age 40 years of age, 1 in 2 have or have had a mental illness. Family doctors are the foundations for the healthcare system, but unfortunately, this has been largely ignored. Family doctors are the quarterbacks in the healthcare system. We need strong team players, other skilled health professionals to help support patient care. As a team, we can provide comprehensive, community-based, holistic care that promotes the prevention of disease and the optimization of health outcomes. We are faced with challenges, but within these challenges lies opportunities. The path forward is actually quite simple. Proactively support the science-based research that patients do best under a team-based healthcare system, and invest now in the public health system, and the long-term positive impacts will be felt for generations. Remember, healthy families are the foundation to healthy communities.
Well, thank you, Dr. Mitchell. And now, for a major announcement on team-based family healthcare. It is my pleasure to introduce our Alberta NDP leader, Rachel Notley.
Well, thank you very much, David, as well, Dr. Mitchell, Dr. Luft, and also to MLAs Joe Cece and Irfan Sabir for being here. And thank you to all of you for your work advocating for healthcare workers, and of course for Alberta families. Now, as David said, many of us grew up with a family doctor who we met with a couple times a year and who we could turn to for advice. Now, as a parent, I took my son and my daughter to the family doctor to make sure that they were growing up healthy and strong, and to deal with illnesses and injuries as they came up. We call this primary care because it's literally the first step in healthcare. Many routine problems and chronic conditions can be fixed or managed effectively with primary care. But today, as David mentioned, access to primary care is out of reach for a huge and unacceptable number of Alberta families. In Lethbridge, in Red Deer, and the entire Bow Valley region, there are no family doctors accepting new patients. I know many families in Calgary and Edmonton and smaller cities are also struggling to find access to a family physician and primary care. And my heart goes out to parents I've actually met on the doorstep, who today literally have nowhere to turn for care for their children other than the emergency room at an overwhelmed hospital. We simply cannot cross our fingers and hope that this sorts itself out. We need a new approach. And I'm very pleased to be here with these folks to talk about that new approach today. Our vision for primary care in Alberta is built up around what we call family health teams. We believe this plan will allow 1 million more Albertans to be able to see a family doctor or another member of a family health team within a day or two, close to home. A family health team can include multiple family doctors as well as nurse practitioners, registered and licensed practical nurses, mental health therapists, pharmacists, social workers, dietitians, community paramedics, community health navigators, physiotherapists, midwives, speech-language therapists, and many more. When you walk into a family health clinic, you will have immediate access to a range of primary care professionals who will help you respond to a problem, manage a chronic condition, and generally support you in maintaining good physical and mental health. This means less waiting, less running around to referrals, and less repeating of your story to one new person after another. Family health teams mean one location to get your family health concerns looked after. Now, we're fortunate in Alberta to have two working examples of a similar model. one at the Tabor Clinic and one at the Crowfoot Village Family Practice here in Calgary, which we'll be touring later this morning. And their results speak for themselves. The Crowfoot Village Family Practice serves 24,000 Calgarians. Each doctor there is able to take on 40% more patients than a traditional practice because many of their patients' needs can be looked after by an allied professional. A study by the Health Quality Council of Alberta found that Crowfoot saved the healthcare system more than $57.3 million over 10 years, and the Tabor Clinic saved even more than that, simply by helping their patients manage their health outside of the hospital. So we can build on the success of those clinics. Team-based care is the gold standard for primary care, and that's what I want to see for Alberta families. That means ready access to a family doctor and the full range of primary care professionals within a day or two. Family health teams will reduce the pressure on our ambulances and our acute care hospitals. They will be great places to work, where health professionals can spend more time helping patients and less time grinding away at paperwork and administration. And by delivering care through these teams, more Albertans will get access to a family doctor or the team members who work with that family doctor. And this is how we will deal with the chronic shortages that we are seeing in so many Alberta communities. Through that, we'll deliver better physical and mental health for all Albertans. An Alberta NDP government will move quickly to establish 10 new family health clinics in locations where they're needed most. How does that work? Well, you can find all the details in our Family Health Teams paper at albertasfuture.ca. But let's have a quick look under the hood. First of all, we need a dedicated transition fund to hire allied health members and place them into existing physicians' clinics where they are requested. This will help us get some immediate impact on the amount of care that can be provided. These team members could be nurse practitioners, registered or licensed practical nurses, social workers, pharmacists, mental health therapists, and many others. Individual needs will vary from clinic to clinic, but we aim to have 1,500 of these new staff placed by the end of 2024. Meanwhile, we'll be working towards opening 10 family health clinics. We'll consult with Albertans about where those should all be. But Lethbridge and Red Deer and the Bow Valley are obvious candidates right off the start. We'll be looking at existing hospitals and clinics as possible locations as well, and make sure that all new hospital projects are designed to include space for this service going forward. We'll consult with Albertans about where we need family health teams who are set up to support specific communities, such as seniors, newcomers, or the LGBTQ2S+ members of our province. I'm committed to meaningful consultation with Indigenous communities and healthcare providers on how to best support Indigenous-led healthcare, and we will back that up with dedicated funding. All family health teams will also have fully integrated mental health professionals. This ties in with our Alberta NDP's long-standing commitment to offering every Albertan 5 sessions with a mental health professional through the provincial insurance plan. We will enshrine our goals and accountability measures for all of this along the way in legislation. This includes the Public Healthcare Delivery Standards Act, which I introduced last fall, and also a standalone Alberta Family Health Teams and Primary Care Act, which we will introduce in the spring of next year, should we be so privileged as to form Alberta's next government. All of this work depends on us increasing our health workforce in Alberta. And as you'll see in our proposals today, we lay out the initial building blocks of what we intend to do to be the largest and most ambitious healthcare recruitment effort that Alberta's ever seen. Part of our offer to professionals will be stable and rewarding workplaces, where you can focus on providing healthcare and spend less time on paperwork and administration. Family health teams will make every single part of Alberta healthcare a better place to work by helping patients sooner and by taking the pressure off of our hospitals and ambulances. Albertans are deeply concerned about the serious damage that Danielle Smith and the UCP have done to public health care. As we approach the election, many folks are asking themselves, who can I count on to end this chaos in healthcare? As your Premier, I will be focused on making primary care more accessible to Alberta families. And by adopting the family health team model I just described, we will ensure that 1 million more Albertans will be able to see a family doctor or a qualified health professional within a day or two. That's our plan. So thank you, and I'm very happy to take any questions you might have, as will anybody else here with me.
All right, thank you, Rachel. Going to questions, we'll first check if there are any questions in the room. All right, thank you. And we'll go to the phones. Just a reminder for those on the phone to use the *9 function, and for those on Zoom to use the raise hand function to get into the question queue. Our first question comes from Catherine Gagowski at Alberta Today. Go ahead, Catherine, your line is open.
So we know that primary care networks didn't quite live up to what they were hoped in a lot of cases. And so you're looking to the Ontario Family Health Team's model. But of course, as is mentioned in the paper, there was some problems with accountability, governance, that type of thing. So when you're talking about enshrining accountability into legislation, can you tell me what lessons were learned from Ontario or from our own primary care network that you'll change and make sure don't happen here?
Well, you know, that's a really good question, because we know that a lot of the benefits of this kind of team-based care have been discussed in a lot of different circles for many, many years. And we've all known that the benefits are there, but there have been different efforts and initiatives to try and bring those benefits to fruition for people who are served by them. And so we've been able to watch what's happened in other places and to learn from both the failures and the successes. And we've seen both failures and successes across the board. So when it comes to accountability, we need to make sure that there are clear conditions with respect to the staffing ratios in these settings, to make sure that we actually have allied health providers working alongside family physicians, because that wasn't always what we saw happen with PCNs. And we know as well that the expansion of the number of patients seen was also a measure that I think was the subject of some discussion in Ontario. But we also know that even with some of the concerns that were in Ontario, that they actually achieved a lot of positive outcomes, and that's why we see Ontario now moving back to again commence further growth of that model across their province. At the heart of all of this is the need to engage respectfully with frontline health providers, with physicians, with nurse practitioners, with nurses, with other many allied health professionals who will provide so many of these critically important services. It must be the product of very serious conversations with them, and it needs to be implemented in a voluntary manner. And I think that by doing those things, we'll achieve success.
Do you have a follow-up, Catherine?
Yes, so I can understand that you go here, there's a team, you aren't going to need to see your doctor all the time, maybe it's a therapist or maybe it's a pharmacist, what have you. But it says here that instead of a patient only having one doctor be responsible, a team can include multiple doctors. And I know a lot of the validators at your news conference, part of the problem is they want to see that one doctor who knows them, so they won't have to retell their health history. They don't want to go to like a walk-in clinic where it's a different doctor every time. So can you explain how that would work? I assume it's not mandatory that you have to go to multiple doctors, and if you are okay with waiting to see your doctor, you can see them. But can you explain the multiple doctor thing?
Well, I think honestly, that is something that I think would be the subject of consultation with the overall family health team in a given family health clinic based on the needs of the patients and the profile of the patients. And maybe not every patient would be a good candidate for being asked to rely on more than one doctor at a time, but maybe some would be. And I think that's where you need to have that flexibility around the team doctor idea. But I think that certainly there's a lot of experience where many times people go to see their physician, and if they're getting, counseling through a mental health therapist, it may well be that the relationship there and the consistency of that relationship is really the more important feature, for instance, to that particular patient than who it is that might be prescribing additional medication in a particular case. So it very much varies, and I think I'm probably getting farther into the weeds than I need to be. And I've got people here who are behind me who could potentially talk about it as well. But I think the high level is that it's a matter for consultation in terms of the nature of the patients and the way the teams work. But always ensuring that people have access to more than just one professional so that more people can get the care they need. And did you want to offer anything?
Yes, I would love to add.
Here.
Thank you. To further add to what Rachel has said, it's important to have a team-based approach because remember, physicians, healthcare providers are human too. We too require self-care. We too require to spend time with our families, to go on vacation, to take care of our health, because we cannot pour from an empty cup. And I think that burnout was something that many physicians, including myself, has said loud and clear over the past couple of years in the pandemic. So yes, you have a doctor, but your doctor is not always available. Remember that. And I think that's a message that many physicians felt. Patients had sometimes expectations that we weren't able to realistically meet being always there, but we will do our best. There'll be other people that will know you, support you, and will work as a team so we can provide optimal outcomes in even the most challenging situations. So hopefully that answers your question. We want to give our best, and we want to give from a full cup. So thank you.
All right, we'll go to our next question from Dean Bennett at the Canadian Press. Go ahead, Dean, your line is open.
Thanks. Morning.
Morning.
Rachel, sorry, indulge me a bit here with one question, one follow-up. I'm going to have to front and hold this one. Just so
So basically, you're going to be asking me 4 questions and then 3 follows? Just
no, it'll be one question of Rick Belly and length. So what I don't understand here, and I was trying to get some answers in the tech briefing, is it's a two-track. You've got to find the people, and then you're going to put them in this system. So I want to focus on the first track because to me, you have a lot of details on the program, but not on how you're going to staff it. I don't understand that. Basically, you want 1,500 by the end of next year. How are you going to find that? Well, I was told, well, we'll find some, people who retire or quit and some grads and stuff, and which to me seems pretty aspirational. But then when we drilled down a bit, we found out that you've actually found out there's 300 nurse practitioners who might be available. So there are some metrics here, but you didn't provide me metrics. And again, I'm only just going through these documents now and I missed something. So my question is, because I think we also learn a little bit more in this thing about what your long-term plan is for recruitment. And to my mind, you're building on a very fuzzy foundation because I don't see how you're going to find the people. You don't seem to have a concrete plan to determine how we're going to find these people. And by that, I mean, they talked about, you talk about the biggest recruitment driver. I don't know what that means in terms of what you're going to do them with. We've talked about working with post-secondary. We've talked about lowering, reducing barriers for international doctors. So that's what I'm trying to find out here, Rachel, is what is your plan to find more health professionals? Because none of this matters until you do. I mean, is it going to be, are you going to poach them from other jurisdictions? Are you going to poach them with broad incentives, targeted incentives? Are you going to try and grow our own with post-secondaries and basically pay for their education if they really work here? I don't see any of that stuff in this plan, and as I say, none of that matters until you present that plan as to how you're going to find these people. So where's that?
right. Okay, Dean, that's a lot there. Let me start. I will say that our proposal that speaks to growing the healthcare workforce does actually have, I believe, 7 points to it, which, you know, in a paper like this by an opposition party is, you know, it's fairly detailed. But that being said, let me start by answering on your 1,500. I think the starting point that we have to, that I find helpful when we talk about this is that there are over 80,000 allied health professionals in Alberta at this point. So we're talking about redeploying or adding 1,500 to the in this transitional part of the plan that we're talking about today, to pair them into existing physicians' offices and to start getting the benefit of that multiplier effect. So when you're talking about that number, which is a relatively small portion of the overall number, honestly, the issue of bringing people back from retirement, coaxing people into taking on more hours so that they're no longer just working, you know, half-time or quarter-time or whatever, and looking at some of the short fixes that can accelerate credentialing of foreign-trained allied health professionals. All of those things are quite realistic, and the number is quite realistic in terms of pairing those folks. And also, it's a question to some degree, or in some cases, it might also be a bit of a redeployment in a way that is more effective. But when you look at the larger context of the numbers, it's not actually you know, beyond the pale to be able to do that. But of course, one critical piece that I want to emphasize is really important is that we need to engage with the unions and the professional associations and those frontline providers to hear from them what kind of strategies will help with the outcome and the objectives that we're achieving here to get them back into the workforce and or to attract them to the workforce. It was interesting to listen to Dr. Mitchell generally as she was speaking about doctors, but this actually applies to all allied health professionals. If you can work in a setting where you're actually able to go home when your day is supposed to end, and you can actually plan an event with your family without having to worry about it being canceled by an emergency, you'd be amazed the degree to which we would be able to attract back into the workforce or grow the number of hours in the workforce of folks who work in the health setting. Going forward, and you're right, you mentioned the nurse practitioners. So we have nurse practitioners in Alberta, and we in Alberta have been particularly ineffective at capitalizing on the opportunity that the training of the capacity of nurse practitioners. So there's really quite an opportunity there because if we invite them into a team setting where they practice as you know, as care providers on their own, then we're going to be successful at you know, getting them more involved and expanding their scope of practice and expanding what they can contribute. And so that's a bit of a, yeah, I mean, it's unfortunate that we have failed as much as we have to get full advantage of nurse practitioners up to this point, but it also means that we have the opportunity to make fast progress as a result. So, yeah, and the last thing I was just going to mention, because you know it's rare that you hear this from me. I actually am very much in support of the announcement that the current government made back in Monday, talking about putting in place more programs to further enhance and accelerate credentialing of foreign-trained nurses. That's a good plan. It's a relatively small plan. You could scale that up and also get some good increases in numbers through that. So it's a complex area, but overall, I think when you look at the size of the workforce, this is not actually as daunting a task as it would seem like. It's practical, it's achievable, and I feel confident that we're going to be able to get there.
Dean, do you have a follow-up?
Yeah, I'll keep it short. Yeah, you say you're going to talk.
Sorry.
What was I going to say? No, you knocked me right off my question.
Sorry.
Well, you've been talking about, are we going to see more details from you, from your party in the election in terms of how you're going to recruit long-term? As I mentioned, you talked about the biggest recruitment drive ever, but you never really put any meat on the bones there. But, you know, it just feels like that's something Albertans need to know from both parties. How are you actually going to find more people, given that everyone's looking for more people? Are we going to see some ideas, or what we saw in your paper today in terms of the broad outlines, strike a working group and you know, try to, you know, reduce credentialing and stuff like that? Is that going to be the extent of it, or are we going to see some more?
No, I mean, I think, I mean, for sure, striking the working group is critical, because we need to engage with folks in the professions to hear from them how best to attract more people to the profession. And you are right that recruitment is happening all across the country and all across the world. So in the longer term, we're going to have to look to training more folks. We are going to have to you know, fund more spaces, but that's a slightly longer term thing, depending on the professional you're speaking about, because obviously it takes longer for people to get through the training process. But so training more people is important. And then, you know, going back a little bit to first principles, I mean, we we did have a reputation of being a pretty good place for people with medical training to come to, and certainly I've heard that from physicians as well. But we've lost that reputation over the last 3.5 years in a really serious way. And so we need to restore trust amongst healthcare professionals across the board, so they will consider coming back here. I also believe that if we are able to truly address the work-life balance that so many healthcare professionals are seeking, then I think we will find more folks going into that line of work and staying in that line of work. Because we see a lot of folks come out of training, going into the line of work, and then not lasting for long because it's too much. And you know, Dean, before I was elected, it seems like a million years ago, one of my jobs was to do labor relations negotiations and advocacy for the nurses union. And I can tell you that back in the early 2000s, they were still in a position where nurses could be told they had to come in to work overtime after a 12-hour shift with, and yes, they'd get paid more, but they didn't get the choice over whether they would have to do it. And they were told whether they were working nights or days, and they were told whether their vacation was canceled or whether it was approved, and they couldn't plan trips because they didn't know when their vacation was approved for, and they had to plan for it not to be ultimately available to them, and that way of employing people in healthcare over the long term is not going to be successful. So we really have to start to reimagine how we provide care to folks in a way that allows those people providing the care to also be healthy.
All right, we'll go to our next question, which comes from Rashmi Kumar from My Radio. Go ahead, Rashmi, your line is open. Go ahead, Rashmi, your line is open. You just have to unmute.
Good morning, Ms. Notley.
Good morning.
Hi. So, yeah, I forgot to unmute.
No worries.
There have been talks about two-tier healthcare system coming to Canada. So what's your take on that? What do you have to say about private clinics and two-tier Medicare coming to Canada? Are you in support of that?
I'm very much opposed to that model. I want more Albertans to have access to good primary care, good family health medicine without ever having to pay a single cent out of pocket. That is not acceptable. Healthcare is a fundamental human right, and it is a Canadian and an Albertan value that people should be able to access that healthcare without first checking to see how much they've got left on their credit limit. And so plans to expand privately funded healthcare are plans that we reject categorically. We've seen the current premier talk about how family doctors should maybe not be completely paid for by the government. Well, I disagree completely and fully and profoundly because I want folks to get the care they need based on what they need, not based on what they earn.
Do you have a follow-up, Rashmi?
Yes, my question is also about a lot of doctors and nurses working odd jobs and waiting for their credentials to be certified. So how would you fast track this? Because a lot of precious time is actually lost in having the professionals come and join on board the healthcare system.
No, you're absolutely true. You're absolutely right. And so we need to speed this up. We need to accelerate it. We need to provide more support in terms of the costs that are being incurred by these foreign-trained medical professionals to make sure that that doesn't block them from being able to access whatever credentialing ultimately is required. And we need to also provide more mentoring opportunities, more residency opportunities, more systems learning opportunities, all in order to ensure that these folks can be brought into and integrated into our healthcare system more effectively. It's a real loss that we have so many well-trained and experienced folks who are unable to provide medical care in Canada when they are equipped to do it. And so this is a problem that has sat too long. And I think because we're in a bit of a crisis situation around access to care, I think this is an opportunity to break down some of these barriers.
All right, we have time for one more set of questions. Our last questions will come from Lisa Johnson at the Edmonton Journal. Go ahead, Lisa, your line is open.
Hi, thanks for taking my question. I was just wondering, like on a basic level, you've talked, Rachel, about your a big recruitment plan for healthcare workers. How many specific healthcare platforms are you going to pitch before the election? Because that recruitment plan obviously is a big part of what you're pitching today.
Mm-hmm. Well, I think, listen, what you can count on from me as, premier, should I be so lucky, is that I will be absolutely laser focused on fixing the problems in our healthcare system and making sure, even more importantly, that Albertans themselves can secure their own health and can have their health promoted and preserved and treated by healthcare professionals across the province. That's what matters to me. And so as a result of that, there'll be a range of things. We've already spoken about a range of things that we would do to improve healthcare even before we introduced this paper today. And there are other pieces that you'll hear us talk about as we get closer to the election. But overall, to me, the provision of comprehensive public health care that makes Albertans that promotes health and preserves health is an absolute priority for me and for the members of Alberta's NDP.
Do you have a follow-up, Lisa?
Okay, so you don't have a specific number. I guess I want to throw what might be a potential criticism at you here. I mean, you talked about the importance of reputation, the reputation of the government that's in power in Alberta. And it kind of seems like you're saying the NDP's reputation you squared up against the UCP, and healthcare workers will be eager to sign up for a family health team or come to Alberta. I can see the criticism being this is a field of dreams plan here. if you elect us, doctors and nurses will just magically come. I mean, how would you respond to that kind of criticism? Because we're not seeing a lot of super specific details.
Well, again, I think we have actually laid out about 7 components to our healthcare workforce growth strategy. And so there is quite a bit there in terms of increasing post-secondary training, accelerating credentialing, consulting around improving work-life balance and other incentives to bring people back in to healthcare, engaging as a matter of principle in consultation and collaboration with healthcare providers, yeah, so I think there's a lot of things there that will actually increase the number of folks who come into healthcare. I mean, we have about 125 family physicians enter the system every year. We need to keep them in the system. We need to keep them wanting to do this job. And so this is not Field of Dreams. It's a real thing that's come as a result of multiple, years of conversations with family practitioners. They want to be respected. They want to be at the table, participating in making the decisions. They want work-life balance. They don't necessarily want to be working 80 hours a week running their own clinic. They'd prefer to be in a team so they can focus on what they do best, which is providing care to Albertans. So we are responding to what they are telling us will keep them working as physicians. And by doing that, we not only maintain, but then over the course of time grow our healthcare workforce, both as it relates to physicians, but also to a whole range of allied health professionals.
That's the time we have today. Thank you, folks.
Thank you.
Thank you.
So much for watching, and to learn more, check out albertasfuture.ca.